This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
One of the things that I say before I leave the home after someone has died, especially if there is more than one person there, is I always say, okay, you guys, I want you to remember that you're each going to go through this grief journey differently, and that's okay. Just know that while you grieve differently, you're grieving for the same reason, for the same person, and that's your similarity. Accept each other for the different ways. Give each other the space to do this in whatever way is best for them, and support each other.
This is the Heart of Hospice podcast with Helen Bauer. My guest, my friend, Gabby Jimenez, is here to share her wisdom, her experience, and her beautiful hospice heart. Whether you're a family caregiver or an end-of-life professional, the Heart of Hospice is here to enhance your hospice experience by connecting you with information you can use about end-of-life care. Today's guest, Gabby Jimenez, Gabrielle, as she was named, but Gabby as we call her, is a hospice nurse, an end-of-life doula, a conscious dying educator, an author, and a blogger. This lady is a powerhouse of hospice and end-of-life information. She has classes, she educates, she supports, and she also works full-time as a bedside hospice nurse out in California. She's got a huge Facebook community, and she has created a safe place for people to talk about death, dying, and grief. She shares end-of-life tips and tools to support and comfort someone who is dying and for their caregivers. She also teaches about how to prepare to say goodbye and then how to navigate grief. She considers the work that she does sacred, beautiful work, and she tries to meet it with kindness and compassion. Gabby is a good friend. She's been on the podcast numerous times. You're going to be moved. You'll hear me be moved, and I think maybe she moved herself a couple of times by this beautiful conversation with this heart of compassion and just an amazing person, the work that she does. So here's my interview, my conversation with Gabby Jimenez of the Hospice Heart. Gabby, it's so wonderful to have you back on the Heart of Hospice podcast. Welcome.
Thank you for having me. It is so nice to be with you again. It's been too long.
It has been. It's like old friends. I love that. So we are going to... Go ahead.
Sorry.
No, go ahead.
Not going to be in this? Like, okay, sorry.
No, are you kidding? Right. We do this 5 minutes in and we goof. Go ahead. We sidetracked ourselves. Okay, we're starting over. This is hilarious.
Start over.
Gabby, it's so great to have you back on the Heart of Hospice podcast. Welcome.
Gosh, it really sucks that I have to be here again. It took everything I know.
This is like what you did the series with us. And I think
Can we start over?
Yeah.
I was trying to be funny and now I have to be serious.
No, you absolutely can be funny.
Okay.
You absolutely can be funny. Yes, it's terrible that you've been on the podcast so many times. We love that. I love having you back. It's been too long. And we did your interview. We learned about the Hospice Heart and all the wonderful things that you're doing, your books. But you've expanded. Your work has taken off. You're doing a lot of things in addition to that, to your writing and your doula work and your work as a hospice nurse. Your full-time job. So we're going to be talking about some of the new things that you're doing, and I'm so excited. So as a nurse and a doula, a hospice nurse, we know that sometimes deaths are difficult. They're complicated. And this is really our focus for today's conversation. Not bad deaths per se, because we have a tendency to say, it was a good death, but complicated deaths that maybe are a little bit difficult for a family, maybe difficult for the patient. So when you talk about that the dying process and the death, what are some of the circumstances that might complicate the dying process?
That's a great question. I think that the obvious, right? Symptom management. If we can't reduce their pain and their suffering, which we make every attempt to, but the body knows what to do. And even when we medicate or we reposition or we educate, at the end of the day, we still do not have control over how a person dies. And so that is difficult sometimes and takes work and certainly teamwork, right? For us to all come together and find a way to manage what is causing such distress for this person. It doesn't happen very often, thankfully. And we can reduce the symptoms most of the time. So that comforts me. But I think the thing that really causes difficulty at the end of life is the dynamics between the people at the bedside. I think it has something to do with how much time they've all had to adjust to the news. If you've had years, you've kind of led to this place, right? But if this is all brand new, like recently, many of our patients have only had a month. They received a diagnosis, was told it was terminal, and have 2 weeks to process this and say goodbye and tie up loose ends. And all of that is difficult. You also have, say, a parent in the bed, right? And then siblings. Maybe one sibling had been there all along, providing all the support, maybe move them into their home. And the other siblings, they come at the end, right? And they want to tell you what to do and what not to do, and how their sister didn't do this right or wrong. And the sister's sitting there thinking, but I was here all along. You guys weren't here. So there's a lot of disconnect. There is, I think some people romanticize a good death, but she's on hospice. Why couldn't you do this? Why couldn't you make this easier? Why isn't she dying now? What is she holding on to? Why can't you stop her pain? And there's curiosity and uncertainty and fear. And I think it really comes from, for the people at the bedside, is to make peace with what's happening and to come together somehow, which has become my role. That's really something I focus on, is the communication I have with them so that they can be at that bedside completely and fully and be able to support one another. Because after that last breath is taken, they have to count on each other to get through that journey. And for the person who's saying goodbye, the one who's in the bed, the one who's dying, is to be heard, to have an opportunity to say, look, I need this. And if you can combine the two, then the death can be a little more, quote unquote, beautiful, right? Because it's conscious, there's awareness, there's the honoring of wishes and needs and wants, but it has to come from communication. And if that's not there and there is too much fear or uncertainty, then that makes the dynamics really difficult for everyone.
I think you hit on it right there. Dynamics. I had a social worker when I first started in hospice, Eloise. She was fantastic. She was sort of my social worker mentor when I started. She called them the dreaded FD, family dynamics. And she was right. Every family has them. Sometimes they're healthier than others. But when you have the grief layered on the exhaustion, layered on the financial pressure, and then whatever historical family dynamics each person is bringing in, the relational dynamics, man, that's a complicated ball of wax. And here we are trying to communicate to make this death smooth, to make this transition, the dying process smoother. And it's challenging. As a hospice nurse, there's sometimes you just have to acknowledge and accept that there are things we cannot change. We're not coming in 14 days worth of a patient's life to undo or correct 50 years of poor relationships.
Well, and we can't pretend to know them all. We can't pretend to know this human being who's dying or those who love them and saying goodbye. We don't know them. We don't know who they were before we got to this point. And my favorite saying is meet them where they are, not where we want them to be. And I think that goes for us as clinicians, but also for the people who are preparing to say goodbye. Well, we have a reaction emotionally to what is going on. Their death is not about us as far as what they might need or what they might wish for at that time. And if we can really truly lean in and meet them where they are and just simply say, what can we do for you? What do you need from us?
Yes.
And if the people at the bedside can come together and say, look, we might have a different reaction or opinion or feeling about all of this, but at the end of the day, we are here together. Let's do this collaboratively. Let's bring a sense of peace so they can feel peace. I think the most beautiful deaths are the ones, even though it's difficult, where all parties have made peace with what's going on and have come together to simply support one another in the best way they possibly can.
Yeah. Acceptance of the death and acceptance of the grief for themselves and for the other grievers. I had a patient once, an older woman who had 3 children. All 3 of them lived locally, but she was living with one who was performing peritoneal dialysis for her. A very complicated procedure, but they lived in a very rural area. And the daughter had agreed, Mom would live with me and 3 days a week, however many days a week. And of course, the patient was deteriorating anyway. And at some point, she made the decision that she was going to discontinue the dialysis. She wanted to sleep. She wanted to sleep in her own bed with her husband. She wanted her daughter to have rest and for them all to have quality time where they weren't spending so much effort, so much mental energy and physical energy to do the dialysis. But she had one son, and he was horrified when he heard about her decision. And he went so far as to tell her that she was killing herself. And he ordered from a funeral home florist these big round wreaths, like they put on an easel at the graveside, and sent them to her house, had them set up, and said, these are the flowers that I will be sending, like what I would have sent to your funeral. But because you're choosing to kill yourself this way, I wanted you to have them before you die.
That's painful to hear.
Yes. And it was horrible to watch them. Of course, the patient was crushed. And her relationship with her son was shot. I know that they did not repair it before she died. It was not fixable in the length of time and with the energy she had at that point. And the relationship between the children was broken, very broken. Who knows if they ever repaired that?
I don't think you can fix that.
Those are things you might be able to move past it, but how could you ever forget something like that? Something so hurtful.
So hurtful. And you can't go back, right? Because first of all, she's gone now. So that can never be undone. That is your forever memory.
Yes.
And I think that's what people don't think about. I meet with that often, especially for the medical aid and dying choices, for families who don't support it and who have come to the bed with disconnect already and anger and all those reactions. And I have found myself very comfortable with looking at them and saying, look, this isn't about you. And I know you have a reaction and that is valid. I'm not going to change your mind, but this is the only moment at this moment that you will ever have. And what she needs and what you need is to just be together and say those things, the I love yous, I miss you, thank you, and goodbye. And deal with your disconnect from the reality of it later. You can have that conversation with yourself or maybe someone professional who can help you with it. But right now, what she needs is to know that you love her.
Right.
And I think your takeaway needs to be that you were there for her when she needed you most.
And isn't that a wonderful word, takeaway? What do you want to take away from this? Guilt, regret, anger, resentment?
Or peace.
Or peace.
Regardless of how hard it is, regardless from your personal opinion of what choices she might have made, at the end of the day, do you need to have peace in your heart that said, I was there 100%? then that's up to you.
Yeah.
You can do that.
Yeah. Can you put your head on the pillow knowing these were the choices you made? Because let's face it, it's a loss. It's a death. You can put lipstick on the pig. We can call it a good death. We can call it whatever we want to. It's beautiful. There's great meaning and beauty in dying and death. And yet it's still a loss. And that's what people move forward with. They move forward with that. So what are some things that we can do to help families, and how can families help themselves as grieving caregiving units to avoid these complicated deaths, these complicated situations?
I think communicate. I think once a diagnosis is given, from day one, personally, I say this all the time. I think you need to start hospice sooner, like at diagnosis.
Yes.
For lack of a better word, the luxury of time. If you actually do have 6 months instead of 2 weeks, which is when some people tend to bring people on the hospice, if you have those months, then you have an opportunity for communication. But however that looks and whatever time you have, I think it's really important for each person to have a safe platform to talk about how they feel, and have each person listening to give them the safe place to say it without judgment, without ridicule, without trying to deflect or change it or make it about them. You're going to have 3 siblings in the room. Their mother is dying. Each one is going to come from a different perspective because they had a different childhood. All my siblings, we had the same parents, but our childhoods were very different. I can't tell my brother how to die or how to react to my mother's death. I can't tell my sister how to tell my brother what to do. And you know what I'm saying? We can't tell other people how to feel. But what we can do is support them and offer them a safe place to be able to express their differences. My brother recently died, that, and my sister and I are disconnected. I haven't talked to her since the service. And the reason is because she did not agree with the decision that I made. But you put me in the position to make the decisions. And what I came from that with is that it's about communication. And you have to collaborate and find a way to accept one another for your differences in opinion, but with the same end goal, which is supporting that person in the bed, making sure their takeaway is that they were loved, and that you, at the end of the day, know you did the very best you could for her or for him and for each other. You have to communicate. Yeah.
I think that's the number one challenge. I have a favorite quote that I like to say quite frequently. 98% of the problems in this world could be solved by better communication. The reason I like that quote is because I wrote it. I say that all the time, but I think that's absolutely true. You name any problem that has to do with grieving and how we are present, either as professional caregivers or family caregivers at the bedside. Communication can always make those issues better. Always make those issues better.
Well, it's very easy to misunderstand what someone is feeling or thinking. We're all guilty of that. And so it takes 2 seconds to say, wait a minute, I'm not sure what you said. Is this what you mean? Right. Because if you can take the time to be sure, to have more clarity, then perhaps you can remove some of the dysfunction that happens after. I think we owe each other the opportunity to say how we feel, to listen, to validate the words that we've heard, and to be able to accept one another for our different ways of thinking. We're different, and that's okay. But at the end of the day, it's about how we care for someone, and it has to come from compassion.
The death is the ending of the grief for the person who's dying. It's not the ending of things for the people that move forward. And of course, it's a huge milestone, right? It's the intense event that all of this, all these circumstances, the work and the angst and everything goes into, is because that death is coming. It's culminating. It's the culmination of everything that's going on. But only for that one person, because the people who are left are moving forward with their grief. There's a legacy there. I call it a death legacy because I think we can create a memory that is painful, like a piece of glass. Every time you pick it back up, it cuts and it hurts, and it reminds you of the things you got wrong or what you think someone else got wrong in their own grief. Or it can be a legacy that reminds you they accepted me when I was angry about this or I regretted what I said, and I accepted them for whatever response they had, because everybody's grief is unique. That's where a disconnect happens a lot of times. I need to grieve my way. It doesn't need to look like your grief. I'm not doing it wrong because it doesn't look like your grief. Someone who doesn't cry at a funeral at a bedside is not
doing it wrong.
Callous. Yeah, they're not getting it wrong. But I think we have a tendency, there's always there's a comparison game and there's a blame game. Somebody's got to be responsible. So get this, life is responsible for death. We are humans. Our lifespan, it's finite. That's the way it works with us. We were created to have an end point. Nobody's responsible for that. There's nobody to blame for the fact that your 99-year-old mother is dying.
One of the things that I say before I leave the home after someone has died, especially if there is more than one person there, if it's siblings or just family members or even friends, is I always say, okay, you guys, I want you to remember that you're each going to go through this grief journey differently, and that's okay. Just know that while you grieve differently, you're grieving for the same reason, for the same person, and that's your similarity. Accept each other for the different ways. One of you may cry hysterically, one of you may not, and that's okay. Give each other the space to do this in whatever way is best for them, and support each other. Be there for each other.
I was talking to a friend of mine whose elderly father, is fairly ill, and there are several children in the family, adult kids, and they have differences of opinion. Philosophy, faith, caregiving. Some of them are remote, some of them are hands-on. So it would appear like they're disconnected, that they can't form a unified caregiving group who can care for their dad. And what I recommended is for them to look at each person as bringing a particular skill set. Remote caregiving has its own perspective, a little bit of an outside caregiving perspective, which is very valuable. I believe that. And hands-on caregiving, that person's the expert in the day-to-day habits and routines and schedules and the eyeballing of what's actually happening in the home. And so what I said is, as a caregiving unit, you're the dream team. Each of you brings your own superpowers. You can't ask for a better caregiving system than that. A couple of them are actually people who work in the healthcare system. And I said, that's great. You bring the insider's knowledge. You speak the language. And then you've got a hands-on child who's providing live-in caregiving. What an incredible advantage. Right there, knowing exactly what dad needs. In reality, you're thinking, how could we be unified? How can we be united in the care that we're bringing? Except for the fact that you all bring special skills and every single one of you has your dad's best interests at heart. That's a strength. That is not a drawback. If you communicate and you respect each other's gifts and the skills that each has to bring to the table, it's the dream team for caregiving. It's just hard to see that when you're sitting inside it.
Well, of course, because I think, and we're all guilty of that. You're so focused on your own reaction and how you feel about it all. It's very difficult to embrace what others are, because at that very moment, especially at the last breath, you can only feel that. And so as long as we're aware of that, as long as we understand that we're all going to do it differently, I think we just have to stop for a moment and pause and just breathe and just take in the fact that we're all having a difficult time, albeit differently, and just support each other. Yeah. We have to find a way to communicate and support each other.
One of the biggest issues we deal with as hospice nurses, hospice clinicians, is confusion about medications, concerns about how to use them. Should we use them? Misunderstandings, myths about morphine and how hospice uses it. So what guidance would you offer about using medications when it comes to symptom management during the dying process?
Great question, because it is something that I speak a lot about, actually, is the fear. I want to remove fear. I want people to understand that, and this is coming from a person who doesn't push a lot of meds. I want to try other things first. So I'm your biggest supporter in that regard. I get how scary these are. I think clinicians need to educate families a little bit more, hear their fears, support and educate them so that they are not afraid, because the medications really are not as scary as people make them out to be. The amounts in general from the beginning that we use are not enough to end a life. And I think people forget the reality. Your loved one has been brought to us because they are dying. They were given a diagnosis. The disease process has increased their decline, and they are at the end of their life. That happened before medications were introduced. The medications are brought in to reduce symptoms. And sometimes they're paired together. Sometimes they're increased, because the end goal is always to reduce the symptoms. We're not ending the life. The disease, the diagnosis, the process, that was ending the life. So when I tell people, if you've been asked to give a dose of morphine or maybe paired with some lorazepam, you need to know that if she takes her last breath after, you did not do that. The medication was given to reduce symptoms. Can they die after that? Absolutely. But here's why. The medications reach that part of the body that is struggling, whether it's with breath or with pain. If those can be reduced, the body can succumb to what it was already doing anyway, only more peacefully. And if that's the case, then what you did by giving these medications was give this person that you love the peace to die without suffering. The medications don't end the life. The diagnosis does. And if you gave those medications, you gave someone you love peace.
That's perfect. The medications don't end the life. The diagnosis does. I think people who are caregivers have such a fear of somehow instigating something that's already in progress, right? But did I cause it? And I always taught families, she got comfortable. You helped her to get comfortable, and she did the work of dying. That's how things progressed. But I think people have guilt, and of course they have fear. So on the flip side of that, as hospice professionals, I think sometimes we are a little blasé about other people's fears. We use morphine all the time. I've used it on 6 patients today. It's not a big deal. You don't need to worry about that. Yeah, don't worry about that. That's a phrase that should never come out of any hospice nurse's mouth. Don't worry about that. Hell yes, worry about that if that bothers you, and talk to me about it so we can educate you and support you and make you feel more comfortable. But I don't think it's a good idea for us to dismiss these fears that people have. I think for them it's very real.
I think that's such a great point, because I think that our knowledge does not negate their feelings. The fact that we have the experience should be the tools that we give them so they can have no fear. You know, a good example of this is when people ask, will they become addicted if we give them the morphine?
Right.
You know, we want to roll our eyes or laugh or say, oh my gosh, that's the last thing you should worry about. But here's the thing. First of all, we don't know their history. What if that person has a history of drug addiction? What if they're afraid of their own reaction to this? What if drug addiction is a part of their whole family? What if that's a real fear? First of all, you validate their fear. You say, I completely get where you're coming from. And on any other condition, that might be something that I worry about. So here's what I want you to do. Because I think she's actively dying, because I think she's close, I want you to trust the medications for the work that it's going to do. If she should rally, right? If she should come out of this, which I do not think she will, and there's any chance that she could become addicted, I promise you, we will revisit this. But for right now and what she's going through, I honestly and from my whole heart can assure you that is not a concern you need.
Appropriate for right now for what she's doing. Yes.
But they're a concern and fear. You hear the words methadone or morphine and you hear death. People say it all the time. My mom was on hospice. They put her on morphine and she died. She was already dying, but your fear is valid. I spend a lot of time educating. I don't want them to have fear. If I walk out that door and leaving them with anything at all, it's going to be that they're not afraid.
Right. Fear is always valid. It is not our job to invalidate somebody's fear. That doesn't do anything but isolate them further and make them feel more disconnected and I think more insecure about the care that they're providing when that nurse walks out of the home. Because it is not our job to stay there 24/7. That is not how we run things in hospice right now. More's the pity, but
we have to leave them with enough tools to have some confidence
yes.
in their role.
Yeah.
Because quite frankly, they're there way more than we are. And so they have to know what they're doing and they have to feel okay with it. We are in no position to belittle their fear, insecurity, or unknown. Nobody knows the stuff we know unless they do this work. And we have the tools. We have to use them in such a way that people can provide better care at the bedside, whether it's family or hired. We have those tools and their fear is real. We need to acknowledge, support it, and help with that.
So when my father-in-law was nearing the end of his life, he died a couple of years ago of the complications from end-stage Alzheimer's. He had a stroke and entered the actively dying phase, and he was very calm. He had not had a lot of pain before, so pain management wasn't really a necessity, but he began having a lot of panting style breathing, the gasping fish out of water, respirations at 36, 38, 40. And he was obviously uncomfortable. He was laboring too hard. So we started talking about morphine and I brought that up. And I got to tell you, when I was teaching, well, not really teaching. I wasn't the hospice nurse. I was reinforcing what the hospice nurse had taught my husband and his mom. I even got a little insecure about the fact that we were medicating him routinely with morphine and thinking, are they going to blame me if something happens? And of course, something was happening anyway, right? We didn't instigate that. We didn't cause it. We helped him get comfortable so he could make his labor a little bit easier. So I want to talk about that because I want to talk about the role of a doula. Because like we're saying, that family is there. They are the caregiving team that stays at the bedside. Hospice nurses and support team, that's just not how we're structured under the way we run the business these days. But end-of-life doulas have a much different role. So what are the benefits of having an end-of-life or a death doula to come alongside a family when a patient has a serious illness or when they're dying?
Well, they call doulas, we call doulas guides, kind of a coach, if you will, in that we can start at diagnosis, walk alongside you through the entire process until after last breaths are taken and along the grief journey. Doulas can stay longer. They're a little bit more available to you. For me, because I'm a nurse and a doula, the doula complements my nurse, but it's a very fine line because doulas are non-clinical. They cannot advise on medications or even symptom management. So I have found that what I've started to do is, even as a nurse, I use my doula explanations to families so that they can understand it better. Because as a doula, I will say things much like I said with you, as far as the medications and the body and how that works, right? It's how you present something. As a doula, you can be at the bedside and reassure the family that this is normal in a way that doesn't sound clinical or overly professional. As a doula, we can choreograph an end of life on someone's, terms and wishes, which is a beautiful thing. I think that families get so overwhelmed by everything that's going on that they lose sight of that. The doula kind of rings everybody back in. Okay, you guys, it's getting to be that time now. Remember, we had that conversation.
Right.
I love to sit with families and give them a little preempt as to what's about to happen so that they know. And then when that last breath is taken, or prior, when maybe there's some body movements, remember we talked about that. This is all part of the process. And to be able to say to the family, one of my favorite things to do is when there's a woman that is dying and her husband of 75 years is sitting there, I'll lean in and I'll say, tell me about her. How did you meet? What was your first date like? Let's go there. And I can bring him in and go to that place of memory. And I know she can hear it. So that gets to be what she takes with her too, right? And he gets to go to that place in his heart of those moments, those special moments, reminded that he still has them and always will. So as a doula, I can choreograph the events to happen in such a way that they're prepared, non-clinically, of course, but also kind of go to that, have permission to go to that emotional place that reminds you. And so I think to have a doula there, you have a guide or a coach that just kind of keeps nudging you along, saying, okay, this is good. You're doing good. Now, remember, he wanted to have this music. Have you arranged that music? Now, remember, he wanted to wear his blue shirt. I think it's a really good time to put that blue shirt on. And to really create this environment that is a little more peaceful, less chaotic, and almost, beautiful. As a doula, you're a guide. You walk alongside all of them together on this journey, and you hear them in the way that lets them know they've all been heard. And then when that last breath is taken, you encourage them all to just sit with it for a moment. Let's savor this moment. That was powerful and beautiful. And you were all here. Look what you did for him. You did such beautiful work. And then I'll sit with them for a moment and I'll step back and I'll give them some time. And then I'll come back in and I'll encourage something like bathing, or I do an after death anointing where we honor and thank him for being the person he was with the life that he led and the gifts that he gave. And I'll do something more ritual or ceremony like, which allows them to have that be the last memory. And then after last breaths are taken and I may leave, I'll check in with them the next day and the next day after that. And I'll stop in, I'll see if they need anything, and I'll give them room and freedom to continue conversations about this person so that they know that they don't ever have to stop talking about them. And then I'll ease them gently into their grief journey. And if they want me there, I'll go with them. Otherwise, I'll make sure they have the tools to do it with a little more sense of competence. I think that's what a doula does.
I absolutely love that. It's enriched. And that's what end-of-life care should look like.
Yes.
That's what it should look like. Oh, you have such a beautiful way of describing it. It's very moving. Makes my laryngitis flare. Gabby, you mentioned ritual, which is an important thing. I think sometimes hospice professionals forget about that piece of things. But I know that's something very common to end-of-life doula work. So can you share with us a ritual that you would do, describe it, when a death has occurred?
Oh, I love rituals. It's one of my favorite things to do. And I have like some basic ones that I do frequently, but I sort of change them up depending on the situation that I'm in. And so while the similarities are there, it's always unique in going with the people and their experience. I make it very much about them. I had a gentleman who, he was too young to die. He was in his early 50s, strong man, worked hard, loved fiercely, had an ex-wife that he was still close to, a couple children that he loved and had a great relationship with, a sister, a brother, a mother, a father, big family. He had a woman that he loved who he was seeing for the last 10 years, who was also close with this knit family. I mean, it was really beautiful, and so many friends. So the first thing I did when I met them was I did my embroidery thread ritual. which is, and I talk about it often, but for them, what I did was, because there were so many people, I cut a strand of embroidery thread, and for them, it was about 20 threads. And they're usually about 12 inches. Usually, if I can, a different color for each person. And then I give them each the strand. I cut it in half. And so they have 2 strands. And I ask that each one of them take a private moment with the person in the bed, tying the string around his left wrist, and tie 4 knots. And with each knot, leave him with a prayer or a sense of gratitude or a memory or a wish or just hope that your journey is peaceful. And with each knot, send him something that is important to you that he takes with him. And then after all the strings have been tied on the left wrist, as a group, come together and help each other tie that matching string on your own left wrist. Also with 4 knots, also with 4 wishes of healing and strength and the courage to get through your grief and the knowledge that you are loved and whatever message you want that person to have. The idea is that that string that is on your wrist stays with you. The string on the person who's dying wrist stays with them. It goes with them. It keeps you tied together forever with love. And then weeks, months, sometimes the string will fall off. And in between, in that time, you can touch the string knowing you're still connected, right? Knowing that you're still a part of that person, that's never going to go away. And when you think about them, you can pull on the string, you could tug on the string, you could touch it and know that when he died, he took that with him too. And when the string falls off, it's almost like the universe is saying, okay, you can do this now. It's time to walk this journey with the strength that you have been given or have gained during this time of healing. You're okay. He's still with you, but you're okay. And for this gentleman, we did that. There were so many people that wanted to do it that the girlfriend ended up buying more strands of embroidery thread. So when I saw him on the day that he died, he had like 30 strings around his wrist, which was beautiful in itself. But then on the day that he died, I wanted to find a way to bring them all together in the different dynamics of how they all knew him, right? Because you have the ex-partner and the current partner and the family members and all of them together. I have this oil, and it's a little bit of white sage, and I have them rub it on each wrist, and I have them connect the wrists together to offer each other love and strength during their grief, knowing that despite how they all came to this, they ended up with the same purpose, which is to support and love him the best way they could, and they have. And in closing, let each other know that you're going to be there for each other and that your love is there. And then after they all touched wrists, I had them do that to his wrist as well, so that they were all connected. And then I did a little ceremony for the ex-wife and the girlfriend to kind of thank them both. One who brought him, halfway into this life, and her who had seen him through the rest, celebrating their connection and love for him. And it was so beautiful to bring them all together, to be able to connect on that level and to just simply say, thank you for loving this person so much the way that you did. And they all got a chance to do that, to honor him and their unique ways of knowing him and how he affected their lives individually and beautifully and wonderfully, knowing that they each had something special, but it was all centered around the same person. So let's honor him. And they did. And it was beautiful, and it was unique and special just for their dynamic. And I walked away thinking, that's what this is about, right? This work that we do, we have life, and then we have death, and it's what we do in between that matters. And when that last breath is taken, I think the most important thing we could do is feel gratitude in our heart for being gifted them and just say thank you.
I've said it before, I'll say it again. We receive so much from our patients and their families, more than we ever give them. They will never know that. Some of them we never see but the one time. But it's an incredible gift to be able to work in this space and to be present and to be witness for things like you're talking about. That's incredible meaning that you're bringing. So you teach ritual. You teach all kinds of stuff. End of life, finding meaning in grieving, all sorts of things. But you actually have some online courses that you're teaching these days through the Hospice Heart. Tell me about the classes that you're offering.
I teach 2 ritual and ceremony classes where I do provide 2 rituals in each one. The one for grieving is about understanding what grief means, supporting you in your journey, letting you know that grief never ends, and that just how to navigate that, tools and resources to be able to work through your grief on your terms. One of the rituals is to let go, which sometimes will be anger or guilt or regret. We grieve better when we've let go of the obstacles that are on our path. And so part of the ritual is to do that. The end ritual is saying goodbye, because many times, especially during COVID, people didn't get a chance to say goodbye.
Yes.
And that's really hard on people. But it's also to send a message. And so I teach the rituals so they can make them their own. I teach another class that is ritual based, which is about forgiveness of self and others, learning to forgive yourself for what you may have said or done along your journey, but also others, not giving them permission for what they did, but simply saying, I no longer want to carry it anymore. That's yours to carry. It's not mine.
Right.
The other is my masterclass. I have a hospice masterclass, which is awesome. It's really great for anyone who's just come on to hospice, but it's really good for anyone who is providing that care. And it's the basics of hospice, because I think there's a lot of misconceptions. And I really explain about what hospice is, what's available to you, what are your resources, because I want people to have the tools and the awareness of what is available to them. I don't think people realize just how much can benefit them if they start hospice sooner. And so I want them to know about the tools and resources. I also teach a class called At the Bedside, which is an introduction to becoming an end-of-life doula. So it's, what is a doula? What does that mean? What work is that? What is that about? I bring in speakers, and oftentimes it's different doulas that I respect and really just love their work, different doula companies who do the certification. I let them share about their programs so that you know that you have choices of what works best for you. And I partner with them in that I will send them some of the people that I think are interested, and then they will send me people that maybe need a little more information. So this class is designed to educate about the doula work, but also about the things that I didn't realize when I took my doula training. So it fills the gaps. And then I have my best 3 months, which is a 7-week course. And it's really about, if you were only given 3 months left to live, what does that look like? What are your wishes? What do you need? What do you want? And at the end of it, you will have designed your own care plan based on what you want and need, something that you can actually hand to people that you love, so that they will know what matters most to you. And I teach, the last one is a self-care class. It's with a combination of breathing, meditation, and yoga. I have a friend of mine who does the yoga portion of it. And each month, we do it once a month. It's only $10. So we're not going to change that. And for every person who buys a class, we'll gift a class. And it's really just an opportunity to be able to learn some techniques on self-care. And learning to take a moment to just breathe and meditate and yoga and stretch. And it's becoming a really, really great community. People are repeating, so we see the same ones in the class each month. And it's really just about honoring your body, mind, heart, and soul.
I love it. I absolutely love it. So how can my listeners connect with you to find the different courses and see what's appropriate for them?
Everything is on my website, which is thehospiceheart.net. And I have all my blogs and poems and interviews and podcasts, like this one will be on there. I have all my classes. I have the links to my books. And I have, it's just a great resource for everything that I offer. And the other thing about my classes, which are all on there, is that I always offer 2 scholarship spots because I don't want anyone to not attend because of financial. And lately I've had some really generous donors who have maybe bought a class to give to someone else. So I'm able to sometimes gift classes. And so it really works out. I want it to work out for people so that they can take them.
That's wonderful. I'll have a link in my show notes to your website so people can see. You have an amazing Facebook group. Your writing is there. You answer questions. You're putting out some amazing content on social media. So all of that will be accessible through show notes. Gabby, you're such a blessing. You bring so much beauty to the show. I'm always moved. Like I said, my laryngitis, that's my tearing up, and I get an overflow when I hear you describe the beauty of these rituals and the care you're providing. It's very special. We are blessed in this industry and this world to have you do this work. So much.
Wow. You know what I really like about your podcast is that you offer people the platform to be able to express what is important to them, reminding us all how different we all are in this work, and that we have, we're all with the same intention, which is to ensure that human beings are cared for well when they die. But you set sort of a light on the awareness of just how many of us there are and how uniquely we do this work, all of which is beautiful. So to be asked to be here today, besides the fact that I get to see you guys again, that always makes me happy. But I love being able to be part of the resources that you offer people so they know that there is so much out there that can be there for them to support them on these difficult journeys.
Well, thank you. I'm so glad you're part of our group. Love you so much, Gabby.
Love you too.
So now you see why I overflowed a few times. When my laryngitis hit me, that's because the tears are coming and my voice gets a little sketchy. I just love Gabby's viewpoint. She has this sweet spot of experience and compassion and still practical and open-minded and energy and discretion. She's just this whole package of caring for someone who's at end of life and for their caregivers. She provides great perspective about addressing circumstances that make the dying process difficult or complicated, challenging. What she says is meet them where they are, not where you want them to be. We walk in a lot of times to a home as end-of-life professionals or even as other caregivers or friends, relatives who have been disconnected from what's been happening with the person who's dying. And we've got judgments, we've got recommendations, we've got opinions. We aren't bossy, but we know what you should be doing. Oh, that's like the nurse's creed these days, right? At least it has been for me. We are a bossy group of people. However, we come into patients' lives when they are dying. They've had a whole life before we even get to them. So we should meet them where they are, not where we want them to be. We're not there to change and fix and convert and make all these things perfect because that's not real and that's not our job. It's important to hear from each person what they're feeling, listen to them, support them. She's totally right. Communication is essential, absolutely, for the team to function well, for the caregiving unit inside the household to function well, and for all of us to function well as a larger caregiving circle for that patient. She talked today about validating people's fears. So maybe they're misguided or misinformed. Maybe they're ignorant about, and I don't mean that in a disrespectful way, but maybe they just have not received education and information about medications or what hospice does, what the hospice chaplain does, right? Who actually knows what those guys do? There's so much misinformation or there's a dearth of information. People just don't know how we use medicines and what each discipline does. So they're fearful of the process, fearful of the services. That's totally valid. All of this is unknown. So put yourself in any other situation where you're a brand new job, where someone's giving you your first job and they're going to train you. Didn't you have some fear about that? Death and dying is on-the-job training for a lot of caregivers. It's their first time to do this. And even if you've been a caregiver for someone else who's had a serious illness, this is the first and only time your mother's going to be sick and die. This is the first and only time this spouse of yours will have a terminal illness and die. The fear is real. So it's important that we validate that and don't disregard it. So end-of-life doulas. I think the conversation around death doulas and end-of-life doulas and how they can support caregivers and patients, I think that conversation is growing louder, which makes me happy because they meet some needs that traditional hospice, Medicare hospice, the way we run it now as an industry, that we cannot meet. And having an end-of-life doula to be a companion, not just for support, but education. Gabby brought up a good point that I'd like to emphasize as well. So Gabby is a hospice nurse, and she is an end-of-life doula. Not all doulas are clinical. Not all doulas are nurses. Many are, but not all. So there is a line where their education and experience stops, right? They can work in conjunction with a hospice team, but they don't always. But they are not necessarily nurses and clinicians. Gabby uses her doula role to complement her role as a nurse, to complement that work, to provide education that's a little more robust and deeper. I love her rituals that she's talking about. That was very moving, where she talked about the ritual of tying the embroidery thread with the knots and using memory and legacy there. And her classes. She's got a variety of classes for caregivers, for grievers, for hospice professionals, for anyone having to consider hospice for themselves, and for end-of-life doulas. There's something for everybody there. So I want to direct you to her website, thehospiceheart.net. You can find her classes there. She has an amazing blog. You want to connect in with her blog, read what she's writing, connect in with her Facebook group, see the questions that she's answering there, whether you're a caregiver, whether you're an end-of-life professional, regardless of your discipline, social worker, aide, nurse practitioner, chaplain, physician, nurse, bereavement coordinator, volunteer. You can find some information and you can learn from Gabby just by connecting and seeing the content that she's writing there. She knows this stuff inside and out. She knows what it's like personally to have a hospice experience, and she shares very openly about caring for her brother at his end of life. So check out thehospiceheart.net and connect with Gabby. She's doing some amazing work. Be sure to catch the next episode of the Heart of Hospice podcast. You can find more episodes on theheartofhospice.com. Don't forget to subscribe on your favorite podcast platform. You can connect with the Heart of Hospice on Facebook and Instagram, and send your questions or comments to me by email at helen@theheartofhospice.com. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.
This is the Whole Care Network. Helping you tell your story one podcast at a time.